Knock, hand hygiene. Hi, Billy. Hi, Mom. My name's Bree. I'm going to be your nurse today. Mom, could you go ahead and identify Billy's name and date of birth for me? I'll make sure that matches his ID band, and it does. So today I'm just coming in to do a head-to-toe assessment, just kind of see how Billy's doing, talk about some like developmental milestones we should be hitting, things like that. So, hey Billy, we're just gonna do an assessment on you really quick. I'm just gonna take a look around, make sure you're doing okay, ask you about your friends, ask you about some toys. Lift this up a little bit. All right, so I'm just gonna take a look at Billy's head first. He doesn't have any anterior or posterior fontanelles. Those should be well closed by now. And his head looks good, it's symmetrical, things like that. His mouth, just taking a look inside. Billy, go ahead and say ah. Oh, good job, that was a big ah. His mouth is pink and moist, so that is perfect. I'm not seeing anything in there that's abnormal. All right, Billy, I'm just gonna go ahead and take your temperature, okay? I'm gonna wave this funny little thing over your head. All right, I'll go to the back of the ear. This temperature is 37, so normal temperature we want is going to be between 36 and 38.5, and anything over 38.5 is considered a fever. Billy, you're looking pretty happy today. I don't see any tears. That's really awesome. Guess you're having a great day today. Okay, so I am going to put this funny little thing on your finger. It has a little red light, and that's just gonna measure how well your lungs are working. And so normal range is 92 to 100, and you're at 95, so that is perfect. Your lungs are working great, Billy. And I'm gonna go ahead and blood pressure we won't be doing today, Billy, just because you're 2 this visit, and we don't do that till you're 3, so come back next year and that's something we'll do. Respirations, I'm just gonna take a look. I'm gonna lift your gown down a little bit, okay? Just looking at your chest here. I'm gonna go ahead and listen for a full minute. So go ahead and take some big deep breaths for me, Billy. Okay, and his normal his respirations were 30, and anything between 25 and 40 is good. And then just kind of taking a look at you, Billy. It doesn't look like you're having a hard time breathing. I'm not seeing any respiratory distress. You're not having any nasal flaring, any grunting. So Mom, if you were to see those things, that's something we would be concerned with, and that he's having a little bit of issues breathing. I didn't hear any wheezing or crackles, but if I did, I would be concerned about asthma in Billy, so we would want to evaluate that further. So now I'm just gonna look at Billy's color here. He has his central and peripheral, so his central is kind of like his trunk and up, and that's like his belly, his chest, and color looks good. It's normal for ethnicity. Temperature feels normal. It's not too warm, not too cold. Okay, and then peripheral temperature is kind of gonna be seen in his lips, so I'm not seeing any blue around the lips. His nail beds look good, so I'm not concerned about that. And then I'm going to go ahead and take a listen to his heart, his apical pulse, and yeah, listen for a normal rhythm in that. And this I'll also count for a full minute. Okay, perfect, Billy. That normal heart rate is between 70 and 120, and you're right at 110, so that is awesome. Normal rhythm, normal rate. All right, so I'm going to lift this up a little bit here, Billy. I'm just gonna take a look at your arms here. Temperature feels good. I'm not seeing any swelling. Looks good on both arms. I'm gonna go ahead and palpate your radial pulses here. Just gonna press on your arms here, Billy. All right, those feel normal, just like your apical pulse did. All right, I'm gonna check your cap refill on your fingers here. Less than 2 seconds, less than 2 seconds, so that is great. All right, Billy, I am going to lift up your gown here. I'm gonna take a listen to your belly, just kind of hear for any rumbling, things like that. Oh, I hear a little bit of rumbling there, Billy. Must have had a big lunch or something. All right, so his vowel sounds are normal. They're normal active. I'm not hearing anything abnormal. So I'm just gonna go ahead and palpate here, Billy. I'm just gonna press down. Let me know if you feel any pain or anything. Does it hurt? Okay, perfect. That is looking good. So, Mom, when was Billy's last bowel movement? Is he going to the bathroom okay? It was this morning? Okay, perfect. All right, Billy, I'll go ahead and lift this down a little bit so you're covered up. I'm gonna take a look at your legs here. Same thing as your arms. I'm just gonna feel around for your temperature or any swelling. Normal temperature, no swelling. If there were any type of emergency, we would want to be taking Billy's femoral pulses, and so that's just right here. We do it the same. And then if he had any lower limb injuries or has any pain in his legs, we would take his pedal pulses, which are right here. Okay, and those are all normal. Billy has been speaking normal for his age. He is having spontaneous eye movements when I was talking to him. Even now, he's having spontaneous movements just in general. And also his extremities are symmetrical, so that's something we're not worried about. But just based off of those 3 things, he is gonna get a GCS score of 15, and that is the highest score you can get. So Billy is right on track for that. All right, Billy, I'm gonna have you get up out of bed here, and we're just gonna see how you walk, okay? Okay? Oh, good job. I'm seeing a little bit of a waddle gait, which is completely normal for his age. They're still kind of having a little bit of balance issues, so it's okay if you fall down a little bit, Billy. Always get back up and keep walking. All right. And yeah, your extremities are symmetrical. Like I said, everything was symmetrical when you were walking. I'm just gonna move back up here, Billy, and I'm just gonna take a look at your skin turgor. So I'm just gonna pinch a little bit and see. All right, and skin turgor is normal and elastic. I'm not worried about any dehydration, but Mom, is he drinking okay? He has a water bottle and things like that. Okay, perfect. And then for urine output, we would want to see 1.5 milliliters per kilograms per hour of urine. So just that's how you kind of know he's going to the bathroom often enough, things like that. And then Billy's weight today is 12 kilograms, and we weighed him earlier, which is really good, a normal weight for him. He's not on daily weights or anything. We would check that if he was. But there's also, with like going off of the urine things, there's this test called urine specific gravity, and it kind of just measures the concentration of solutes in Billy's urine. And that's not ordered today, but if it was, that's what it would be looking for. All right, and then now I'm just gonna talk about some like developmental milestones, how he should be progressing along now that he's 2. So some of the gross motor skills we're wanting to see in Billy are he's able to walk, which he showed me earlier. He's able to jump with 2 feet, so he can jump like this. And then also his fine motor skills, so kind of some things involving those smaller muscles, are like holding a crayon. So Billy should be able to hold a crayon at this age and be able to use it properly. And he is able to do that just fine, so that's not a concern. Speech, so Billy should be speaking in 2 to 3 word phrases. You should have about a 300 word vocabulary. and he should be able to say words like I, me, you, or like juice or milk when he's hungry, things like that. For play, Billy is in parallel play, so if he is around any people or any other kids his age, they will both play near each other, but they'll never like play directly with each other, so they'll have their backs to each other, and that's something that's really normal. And then play-wise, like toys, he will be playing with like those push-pull toys. So Billy, if you got a little lawnmower and you're mowing the grass, things like that, cardboard books, pounding toys, those are some activities that he'll like to do. All right, Billy, I am gonna lower your bed a little bit. All right, do you have any questions for me, Mom? Okay, perfect. Thank you.